So we don't know the exact cause of narcissistic personality disorder, but we believe that both learned and inherited factors play a role in its development. Narcissistic personality disorder may be linked to mismatches in parent-childhood relationship. Sometimes excessive pampering or criticisms may bring this to effect. Also, there is the genetics and psychobiology. The connection between the brain and behavior and thinking is known to be responsible for this. Researchers think that biologically, researchers believe that biologically, vulnerable children parenting lifestyle that overemphasize their child's specialness and criticize fears and failures may be partially responsible for this. So it is something that we take not too superficially, but we know that this is very important. So from that they have this sense of belief of self-admiration and a sense of self-admiration. Now, what is the prevalence? How common is it? In the general population, it occurs between 0 to 6.2%. So in some, it may not be very common. In others, it may be a little, it may be available, it may be well known in some other situations. It's known that it affects more males than females. It often begins in the early teen years and also early adulthood. What are the symptoms of this type of personality disorder, narcissistic personality disorder? They have an exaggerated or grandiose sense of self-importance. So they have this feeling of big, and they feel that they are very important. They expect to be recognized as superior without commensurate achievement to that, to what is known by the people. So they feel that anywhere they go, they must be recognized. They must be recognized, and they feel superior. But you cannot, if you really look deep, you cannot see why they are claiming what they claim. That is one thing that is common. Also, they tend to exaggerate their self-achievement and talents. So they exaggerate what they have done. They exaggerate who they are. They exaggerate what they've achieved in life, and is a feeling that gives them a sense of fulfillment. Now they are also being preoccupied. They feel they're preoccupied with their exaggerated achievements and talents. They also spend time focusing on their unlimited success, their power, their intelligence, their brilliance, their beauty. That is who these people are. Also, they believe that they are special, they are unique, they have a special gifts that can only be understood by them. They also want to associate with people of equal, special, and high status in the society. So they want to always hang out with the rich the mighty and the powerful. That is one thing that they always do. They constantly require admiration. They want to be told how good they are, how important they are, and they spend a lot of time making people understand that a lot. They also have this sense of entitlement, and that means when they walk into a place, you must recognize them. When they get into a situation, you must give them their respect. You must give them a space. You must let them be in the front. You must show them some recognition. When they walk into an occasion, you have to say, well, okay, XYZ has just walked in, and they enjoy that bravado of being the center of attraction. They also expect special favors. They expect special favors all the time. And they ask for compliance with their expectations. You don't have to question who they are, question what they do, question why they do what they do. These are narcissistic personality disorder people. They want you to know who they are. They want you to recognize them. And when they say something, you have to do it. One other important characteristic of these people is they are very exploitative. They can take advantage of other people to achieve their own goals. So they set out, if they want something, they get out there, they get it, they can manipulate anybody to get what they want. They don't really bother so much on how somebody feels. They want to get what they want, and it doesn't matter who is involved or how the person feels. They want to make sure that they get it. They want to make sure they get it, so they can exploit any situation, anybody, to get what they want. And they take advantage of people. That is another characteristic, and whatever they want, they can do to achieve their goals, they will do it. These people lack empathy. They don't care how anybody feels. They lack empathy. They do not recognize the needs or feelings of other people. They look at you, they know what they want, they go get it. It doesn't matter how you feel. They get it from you, and they just keep going. They don't look at your own feelings or how it worries you or how it bothers you. They don't really care. They go set out to their own goals, and they get it, and they take it, and they keep going. Some people, when you take advantage of them, of course, people feel bad, people feel very unhappy. If they mention it to them, if they dare say, hey, I don't like what you did, or you're taking advantage of me, they get upset. They really go off. Because who are you to question the narcissistic person? Who are you to question the goal of what he's doing? When a narcissist wants something, he goes to get it. They are also very envious of other people. And they also believe that other people envy them. So when they look at you, they say, you're jealous of me. That's why you are questioning what I said. So they feel that they are the best thing that happened to this planet Earth. So the narcissist will always make it possible for him to get his way. He will always want you to follow what he says. He will always want you to take directions from him. Whether it's suitable for you or not, he wants you to follow his direction. That is the way narcissists act all the time. So it is for you to understand this illness, whether it's a family member or is somebody who a significant other, your parent, or your child. These are some of the symptoms. And another characteristic is they behave in a very arrogant and haughty manner. They're very arrogant. They feel that there's nobody better than them. They have the best knowledge of anything that you want to talk about. The narcissist can get a job even though he is still learning, even though he is still not very sure of what he's doing. You cannot teach him. When you try to teach him, he will always talk over you because he wants to show that he knows it more than you. That is the way they feel all the time. And they don't think that anybody knows better than them. They think that they are the best ever thing to happen to the planet Earth. And in course of that, they really they don't bother how it affects other people. They're not worried how people feel. They're not worried how it makes other people, how it affects them. So they just continue to do what they want to do. The narcissist person will always overrun somebody to get what they want. These are the symptoms of narcissistic personality disorder as listed in the Diagnostic and Statistical Manual of Mental Illness, the DSM-5, which is the Bible of Psychiatry, published by American Psychiatric Association. If you meet the criteria, if you have about 5 of these symptoms, the person is said to meet the criteria for narcissistic personality disorder. And as we know, this is their personality. This is who they are. This is how they were born. This is the way their brain is wired. So it is hard for them not to act that way. So a lot of the times what happens, they have conflict with people, especially when you're trying to take advantage of somebody and you know that what you're doing is not right. The person understands it and the person questions it, then it becomes a problem. The narcissist cannot be questioned. He will always do what he wants to do. All right, so this illness, how does it progress? What is the cause of the illness? The personality in a person with narcissistic disorder, the traits may be common in adolescence. You may begin to notice it in an adolescent. From age 14, 15, 16, you notice that somebody wants to take control of other people. Nobody can talk when he's talking. So some of these traits may be present in some adolescents, but it does not mean that they have narcissistic personality disorder. But if you follow them through to some point or some stage in their life, the chances that they may develop narcissistic personality disorder is there. But not all those teenagers or adolescents who have some of these traits end up having narcissistic personality disorder. Now, the people with narcissistic personality disorder may have difficulty adjusting to difficulties that come with age. As we grow older, there are some things we cannot do anymore. Our physical looks progressively change. The way we do things may become a little more difficult. The energy and the drive may be less. So a lot of people with narcissistic personality disorder have a hard time coping with that change that comes with age. But overall, as they grow older, the tendency is to calm down a little bit, but every time an opportunity comes, the personality in them will show up. They will, you will see them, they will still act out. They want to be the center stage of wherever they are. Now, how do you make a diagnosis of narcissistic personality disorder? How do you make that diagnosis? Narcissistic personality disorder is diagnosed based on the signs and symptoms as I enumerated before. Once they meet five of the characteristics or the criteria listed in the DSM-5, you can say that they have a narcissistic personality disorder. Now, how do you make that diagnosis? It is done by a thorough psychological evaluation, which may include multiple questions, questionnaires, and the psychologist or the psychiatrist will ask different questions, and they can come up with that diagnosis. But initially, always as physicians, we do a good physical exam, make sure they don't have any physical problems causing their symptoms. Then the evaluation, in the evaluation, we look out for the features of narcissistic personality disorder, and the diagnosis is made. But it's noteworthy here that some characteristics of or some features of narcissistic personality disorder are similar to those of other personality disorders. So also it is possible to diagnose one personality disorder, more than one personality disorder at the same time. So if the symptoms of personality disorder are present, the doctor who has performed the evaluation will make the diagnosis. If physical symptoms are present, usually we make sure that with lab tests, MRI, and physical exam, that we the symptoms we're seeing, or the symptoms that the patient is displaying, is not caused by any of these symptoms. Once physical symptoms have been excluded for the behavior change, they are now referred to a psychiatrist or treatment, or a psychologist for treatment. I would, I think at this point we should take a break. Let's take a little break, and we'll come back shortly. But before we go, I'd like to say thank you to one of our sponsors, Paddock Healthcare Pharmacy. It's a family-owned pharmacy business here in Maryland. It's on Bladensburg Road, and their phone number is 301-277-7107. It's a family-owned pharmacy. You can call and go there and get your medications filled. They are relatively cheap compared to other pharmacies. Thank you, Paddock Healthcare Pharmacy, for sponsoring Dr. Gilead's show. All right, I see Dobbs Frank. Thank you for tuning in today, and so many others that I cannot see. But stay tuned. Don't go away. We're still on Dr. Gilead's show. We'll take a short break. Don't go away. We'll come back shortly.
You know, I've always wanted to go to Peru. I just never had the time. But that never stopped me from eating their delicious food. Come on down to Peru's Chicken in Lanham, Maryland, or Mitchellville, Maryland. Their spices will take you to Peru. Have you been looking for a new car? Godwin Motors has got got you covered. Check out their credit stimulus package sales event. 100% credit approval regardless of credit, and emergency lenders on hand. Godwin Motors is located at 9071 Lanham Severn Road in Lanham, Maryland, 20706. Log on to their website at www.godwinmotorsonline.com or call 301-577-0400. That's 301-577-0400. That's Godwin Motors. And let them know you heard about them on WBGRsports.com.
All right, hello everyone. Welcome back to Dr. Gilead Show. Today we're talking about narcissistic personality disorder. Narcissistic personality disorder, in continuation of our discussion of personality disorders. We are on Facebook Live, Dr. Theo Oswala, MD. We are also on WBGR Radio. If you are in the DC area, you can call on 301-429-9247. 301-429-9247. You can call to ask a question or make a contribution, or if you have a family member or someone you know who has an illness or who acts exactly the way we are describing, you can make a contribution by calling on 301-429-9247. All right, we've talked about the symptoms and signs of narcissistic personality disorder. We've also talked about the cause, how the illness progresses, and also how to make the diagnosis. Let's look at the risk factors. What are the factors or the things that may increase the risk of someone developing narcissistic personality disorder? Now, we know that family history of narcissistic personality disorder, or we know that narcissistic personality disorder is more common in those with other family members who have a personality disorder, or even psychiatric illnesses in general. So we know that having other mental illness, such as depression or bipolar disorder, in family members also can be a risk factor for someone developing narcissistic personality disorder. So it is known that among family members, it is not uncommon to have narcissistic personality disorder or other personality disorders if you have family members who have this, even what we call Axis 1 psychiatric illness, which is major mental illnesses. So once we have family members with such illness, we also sometimes anticipate that there might be other family members who may not have the big ones, the big psychiatric illnesses, but they may have personality disorders. So the risk factor here is genetic, based on a relationship with family members. And once that happens, once we notice that, we take into view that there may be chances that these family members may have narcissistic personality disorder. How do you treat this illness? Remember that personality disorders are part of us. They are part of our the way our brain is wired. They are part of how our brain runs. So it is difficult to treat. It is hard to treat. But the main treatment of personality disorders, as well as, of course, narcissistic personality disorder, is psychotherapy. It's been known that psychotherapy can give some help. It can bring some, it can give the person some respite. if they really accept to be part of a treatment protocol. Now, so the question is, how does psychotherapy help? For those with narcissistic personality disorder, psychotherapy can help you, one, to learn to relate better with others, to learn to understand how when you want to get what you want without caring about how people feel, how it affects those people. So it teaches you, psychotherapy teaches you how to relate better with other people, how to be more intimate, how to enjoy a rewarding relationship. So when we treat these personality disorders, people learn how to manage relationships better. Also, psychotherapy helps people understand the causes, the real reason why their emotions go the way they go. They learn what drives them to compete, what causes the distrust they have, and exactly what makes them despise other people. Remember, people with borderline, narcissistic personality disorder feel that they are the most important people in the world. They feel that they are the most important thing that has ever happened to you, if they are in a relationship with you. They feel that they are the most important people. They are grandiose. They are big. They look down on other people. So in treatment, they are taught to see people as fellow human beings. They learn to tolerate people who they probably, prior to psychotherapy, they see as nothing. They see as little people that they can associate with. So psychotherapy helps teach them on how to relate with people. And if they learn it, they do well. Also, psychotherapy helps teach them to know or to learn areas that they can change. It directs them to areas that they can use to help themselves, so that they can accept responsibilities and learn to accept the way they act towards people. So in learning and accepting responsibility, they accept and maintain a real personal relationship. Because in relationship, these people are aloof. They don't care how other people feel. But when they accept responsibility for what they do, what that brings to them is they learn to maintain real relationship with people. Even at their job, they begin to collaborate with co-workers. Because prior to then, what happens is they believe that they are the best thing that happened to that job. So there's nothing you can tell them that they will listen. Now, they also learn to accept their real, actual competence. They accept how well they do. They learn to accept how well they do things, how well or how much they have achieved, and not what they perceived that they have achieved. Remember, they are grandiose. They feel that they are on top of the world. So, anything they believe or they thought they should have achieved, they begin to claim that they have achieved it. So what psychotherapy and teaching to have them accept responsibility is to help them recognize and accept their actual level, their actual potential, and their actual competence. So that will help them to accept or tolerate criticisms and failures. So when they fail or when they are critiqued, they will say, okay, well, I'm not really the top notch that I thought I was. I'm not really the big man or woman, the guy that is in charge that I thought I was. So when you critique them, they take it better. They handle that criticism better. And when they fail, they don't feel real bad and withdrawn because they see that, well, I'm just a normal human being. They begin to act differently. Now, psychotherapy also helps them increase their ability to understand and regulate their feelings because they feel on top of the world. If something bad happens, if a failure happens, the tendency is to want to kill themselves. So therapy helps them increase their ability to understand and regulate these feelings. So when they have failures in their life, failure is natural. Failure will always come. It doesn't matter how big you are or how rich you are or how experienced you are in life. You will have some failures in life. But people with narcissistic personality disorder cannot just take it. They cannot tolerate it. They feel so distraught. Sometimes they commit suicide. So the therapy helps them to regulate these feelings. Now, in therapy, they also learn to understand and tolerate the impact of issues relating to their self-esteem. So they have an exaggerated or an inflated self-esteem, which if you critique them is like you put a hole on their self-esteem, and you puncture their feeling and their grandiose self. So they crash so sad, they crash so bad. It becomes a big problem to them. But once they learn how issues, failures, and things in life affect their self-esteem, they calm down. They take things easy, and they don't really get hurt when something happens. Also, in therapy, they tend to release their feelings of unattainable goals. They also learn to manage ideal conditions, and they begin to gain acceptance. They begin to accept what is attainable and what they cannot accomplish. So generally, psychotherapy is more of educational and more of directional. So they get help understanding who they are, who they really are, and not who they think they are, or who they wish they were. Once they understand their actual status, their actual person, now they can manage their emotions. They can manage things better. And they look at, what have I accomplished? Is it really what I portray myself to have accomplished? And once they see the difference between their wished or their exaggerated accomplishment and their real accomplishment, they can now manage their emotions better. They can manage things better. Especially when someone says, you haven't done this, you haven't really achieved this. Or when they talk to people, they tend to talk to people in a better way. All right, so are there medications that have been approved to treat narcissistic personality disorder? The truth is that there are no medications that are approved for treatment of narcissistic personality disorder. But some medications are used to manage emotions, mood, and other things that may co-occur. For example, there are medications that are used to treat mood stabilization, as well as treat other co-occurring illnesses. Sometimes because they are not at their perceived place where they felt they should be, they have anxiety. So they begin to freak out when things are not going the way they expect. They begin to get nervous, have palpitations, shaky, just some anxiety symptoms. They feel their heart beating so fast, and that kind of puts them in a very tense mood. So at that point, anti-anxiety medications can be used to help calm them down. Also because they have a perception on where they should be, on how rich they should be, on how big or how prominent they should be. So they feel depressed if they are not at those levels. If they have not achieved those things they wish or they thought they would have achieved, it becomes a problem. So they feel depressed, they withdraw, they hide, and they become very distraught. And sometimes some have attempted suicide because they see and that they cannot get to where they thought they would get. Also, because of their self-esteem and the depression, they also indulge in substance abuse. So they end up looking for ways to make them feel better, to make them feel good about their self-esteem. So they are unstoppable. They feel big. They feel nobody can talk to them. Sometimes if the wife or the spouse tries to tell them to accept where they are, what happens is they get very, very angry, and they have been situations where they beat up their spouse, they beat up their wife. So they traumatize family, their children, and everybody runs away from them. So these narcissistic personality disorders, they don't care about the feelings of other people. But in treatment, we give them some treatment that will help them feel better, help them think better, help them realize that other people, whether brothers or friends or people in the society or their spouse or their children, are human beings too. And we also teach them to understand that these people can really exist without you. That is very painful to them because they think that they are the best thing that has happened to those people. Now, I want you to note this. If you are on this platform and you're listening and you think everything I have said, talked about, that you fit the criteria, please do not feel defensive about treatment or think it is unnecessary. Because I know that the nature of narcissistic personality disorder can also make you feel like you're the best, but also before you know it, you get into treatment, it translates to the therapist, and you make them feel that they are no good. So people with narcissistic personality disorder, when they get into treatment, they think, what is this person talking about? This is not worth my attention or my time. And because you feel that you're the best thing, who is this therapist that will tell you what to do, you quit. I want to say this. If these symptoms and signs sound like you, don't worry, do not quit. Go ahead and get some treatment. It is important that you keep an open mind if you're going to go get treatment. Focus on the rewards of treatment, how this treatment will help you. And when the therapist or your treatment team give you a treatment plan, that means how to go from step to step on how to get you better. Please stick to it. And I'm talking to you today. If you have a narcissistic personality disorder, try and stick to the treatment plan. Do the best you can to attend the scheduled therapy sessions. And if there are any medications that have been prescribed, take them as directed. All these will help you feel better. Now remember, it can be hard work for you, and you may have occasional setbacks when you are in treatment, but don't worry. Do not worry. You can still do it. You can feel better. You need to learn about your illness. You need to learn about narcissistic personality disorder. You need to get yourself well educated about the illness. That way, when you learn more about it, you can apply what you're reading to yourself. You can notice when you're reading something, you notice, whoa, this is me. This sounds like me. This sounds like what I have done before. This is how I think. This is how I feel about myself. So it is always very important to get the treatment. Now, if you are one of those who who is self-medicating, if you are one of those who is self-medicating with substances like alcohol, because you cannot take failures, you cannot take criticism, so you go and drink alcohol, or if you have advanced to using the big medications or big drugs out there, cocaine, heroin, to drown yourself into your thoughts and feelings, please, you need to get help. Do not treat yourself with those substances. What happens, those substances will rather make your situation worse. I want to encourage you. You need to learn relaxation and stress management. When you're feeling so flamboyant, even though you are not rich, you're feeling grandiose and big when you really have nothing, you feel you have achieved everything, when really you haven't achieved that much, what you need to do is take a break, sit down, take a deep breath, learn about what you have achieved. Give yourself a self-assessment of where you are. Look at where you are. Look at what you know what you're doing. Are you really who you say you are? Are you really what you portray yourself to be? Once you learn that, actually I'm not who I say I am, you take a deep breath, you begin to relax, you can go through stress management with specialized treatment personnel. You will feel better. You need to try stress reduction techniques such as meditation. So people have really benefited from meditation. Yoga is one helpful thing. Just isolate yourself in your room, no noise, sit down, take a beautiful posture and take deep breaths. Practice yoga. All these can help and give you some soothing effect and also give you some calming effect. They are very helpful. You can practice it and you will see how calm you become, and you will learn to manage your feelings. Also, very important is to stay focused on your goal. Recovery from narcissistic personality disorder takes a long time because this is how your brain is wired. It takes time to unwire it. If there's anything like that, it may not be possible to unwire it, but you can learn how to override your thoughts. You can learn to override how you are acting. You can learn to, when you get to a place, to calm down. Even though your brain says, announce your arrival, let them notice you. But you can say, okay, I am just a normal human being. I am not the best thing that happened to this gathering. Or I'm not the best thing that happened to this organization. I am just a regular person. Let me wait until I'm recognized. Let me wait until someone gets attention of who I am or notices that I'm here. So once that happens, you'll be able to learn to manage your emotions, manage yourself. Know that it takes time, it takes a lot of work, but it's doable. You can do it. Also, stay motivated by keeping your recovery goals in mind and reminding yourself that you can work to repair damaged relationships and become happier in your life. So, you know, the real aim of treatment is to say, well, I have made mistakes, I have done some things to people, I have caused harm to my family members, I have really hurt people because of how I felt about myself, because I've always felt that I'm the best thing that happened to them, or they cannot do without me, and you hurt them, you beat them up, or you yell at them, you don't care about how they feel. Remember that getting better will help manage that relationship. Will get your family, your friends, and your co-workers back to relating with you better. So that should be your primary goal of getting the help. Now let's look at what are the complications that can happen with narcissistic personality disorder if left untreated. So they can have relationship problems. They have difficulty relating with people. They have difficulty managing their homes. They have difficulty relating well with their spouse, with their husband, or with their children, or with their wife. It becomes a real big problem for them. So they have problem at work. They have problem at school. Because in school, if you're a narcissistic personality person will not want to listen to the teacher because he thinks, what can the teacher teach me? At work, they don't want to take orders from the boss. I'm better than him. What is he going to tell me? So these are problems. So they have relationship problems at home, relationship problems at work. And at the end of the day, what happens? They have depression. They feel depressed. And when they feel depressed, what do? They use drugs to overcome it. So they drink constantly. They drink constantly. They do drugs to calm themselves down or to block that feeling or that relationship that is messed up. So they need a lot of help. And sometimes they feel like killing themselves because they feel that they have failed. They have failed in their relationship. They have failed in their work. So please, these are some of the complications. And what happens? The prognosis, the outcome, is fair, is better if they get treatment and as they get older, things seem to get better. Now, I have an advice for the family members. If you have a son, a father, a wife, or a husband, or some co-worker who meet all these criteria, it is good, it's advisable to get them the help that they need. Try and set them up to go see a specialist. Try and ask them to go see someone who can treat them. This can help save your relationship. This can help save your loved one. This can help save your children. This can help save your parents. Now, try. And because they are narcissistic, they don't care. They say, no, what are you going to tell me? I know everything. But if you persist, if you persevere, if you continue to tell them, or even use people who they respect, there must be somebody they respect. There must be people that they respect. If you get those people involved and say, listen, I think my wife, my son, or my father, or my husband has this problem, I think he can get help. And they can talk to them, and they can go get help. When they get help, the family relationship will improve. Instead of critiquing them, abusing them, show them love and encourage them to get help. That is one of the best ways that you can support them. Quitting that relationship or disowning that son because they are narcissistic or letting them go from their job does not help the individual. Rather, what it does, it puts a hold on their ego, and they end up doing drugs, alcohol, or sometimes they may kill themselves. So this is for family members, but individuals who meet this criteria, I encourage you, put your ego down, go get some help, and I think you will do well. I want to thank everyone who has called in today, Dobbs Frank, Victor, Professor Hanuzo, also I see Joke, all from the way from Nigeria, others from Maryland, Canada. Thank you in for tuning in today. We talked about narcissistic personality disorder, and if you look at this, you will see why people behave the way they behave, why they act the way they act. They don't really intend to hurt people, but their nature, the way their brain is wired, make them act the way they act. Show them love, support them. If you have these symptoms, go get help. Thank you for tuning in today. You've been with me on Dr. Gilead's show. Dr. Theo Oswala, I'm your host. Thank you very much. You can call me on phone number 301-577-9111. 301-577-9111. Or you can also send me a message on my Facebook page, Dr. Theo, one word, Oswala, MD, one word. Ask questions, make comments, and I will respond to you. Thank you. Stay tuned. Please don't go away. See me next week again on WBGR Radio and on Facebook Live, same time, same place next week. Thank you very much for tuning in. Bye-bye.